Good afternoon. Today's date is March 20th, 2020. We are here for the media briefing on the COVID-19 response in Buncombe County. I realize that there is a slight delay for those of you who may be viewing this on Facebook Live. So just to reassure you, we started a bit late, and so we're not exactly on schedule, but we are going to do everything we can to accommodate questions considering the delay. So please mute your phones if you are calling in on the conference line. This is being streamed live on Buncombe County Government's Facebook page, and that handle is at BuncombeGov, BUNCOMBEGOV. And the simultaneous Spanish version of this conference is being aired on the Buncombe County Health and Human Services Facebook page, and that Facebook handle is at BCHHS. Today we have Dr. Jennifer Mullendore, Buncombe County Medical Director and Interim Public Health Director, speaking to us to give a situation update. We have Dr. William Hathaway, the Chief Medical Officer with Mission Health, and we have Fletcher Tove, Buncombe County Health and Human Services Public Health Preparedness Director. And at this point, I will turn it over to Dr. Mullendore for an update. After all of the updates have been provided, we will answer some Q&As. Thanks.
Good afternoon. At this time, there remains only one known case of COVID-19 associated with Buncombe County. However, the case count continues to increase across the state. As of 9:30 this morning, there are 137 cases of COVID-19 in North Carolina. And yesterday, the first known case of community transmission of COVID-19 in North Carolina was reported in Wilson County. From Tuesday through Thursday of this week, a total of 370 specimens were collected through the Buncombe County Health and Human Services community testing sites at UNC Asheville and Biltmore Church in Arden. And over 700 tests have been collected on individuals in Buncombe County as a whole through 11 o'clock this morning. We expect that the results of many of those tests will return early next week. As we continue into this new phase of response, the role of testing for COVID-19 is being reevaluated to ensure appropriate management of resources and gathering of important data. Most people who become ill with COVID-19 develop a mild illness that can be managed safely at home. Keeping ill people at home reduces the chance that people will be exposed to the illness. Regardless of whether a person who is mildly ill with fever and cough gets tested for COVID-19 or not, the medical guidance remains the same. Stay at home until your symptoms have improved. Specifically, people with fever and respiratory symptoms, including those people who have laboratory-confirmed COVID-19, should isolate themselves at home until the following conditions are met. It has been at least 7 days since their symptoms started, and at least 72 hours after their symptoms went away. And what that means is that they don't have fever without having to take a fever-reducing medication, and that they have improvement in their respiratory symptoms. As we start seeing community spread of COVID-19 in our area, which is likely in the coming days to weeks, testing may become more focused on people who are hospitalized, healthcare personnel, and those individuals who live in congregate living settings like nursing homes and jails. We want to make sure that we have enough resources to take care of those who are at greatest risk of serious complications from COVID-19. We want to make sure that we have critical resources both now and in the coming weeks to months, as it is likely that this outbreak will continue for the foreseeable future. Based on all of this information, and in an effort to ensure the most effective use of our resources, our testing supplies, personal protective equipment, and healthcare personnel, we at Buncombe County Health and Human Services decided not to open our community testing sites today. Testing remains available through local healthcare providers and urgent care settings, and we at Buncombe County continue to have tests available for those most in need. Preparing for community spread is why we have emphasized and continue to emphasize social distancing measures. I cannot stress enough how important these measures are. We must all do our part. Our actions matter and will help protect the most vulnerable in our community and minimize the spread of COVID-19 in our area. If you are at high risk, an individual over the age of 65, a person with chronic health conditions, or a weakened immune system, I strongly encourage you to stay at home to the degree possible. I will now turn it over to Dr. William Hathaway with Mission Health.
Thank you, Dr. Mullendore. I appreciate that. Good afternoon. We have an update from Mission Health today, a fairly brief update. We've received lots of questions and concerns about the availability of personal protective equipment, as Dr. Mullendore spoke about. And again, I want to reiterate to folks that we have currently an ample supply for our needs. I think as people realize, as they've watched the epidemic unfold and come towards our community, it's a constantly changing dynamic. And if we've learned anything from other countries and from other places within our own country, the availability of PPE is probably one of the most critical facets of our challenge. So today we look good. We continue to secure our supply for the community, and we will continue to update people. The second issue I want to address is the testing, as Dr. Mullendore spoke about. We've gotten lots and lots of concern about who should be tested and when they should be tested. And I want to reiterate that the testing process itself consumes personal protective equipment. And for that reason, we are encouraging people, as Dr. Mullendore said, to contact their doctor if they have symptoms, strategize with them about whether they need to be seen or not seen. And in general, what we advocate is that if you wouldn't go to the doctor for this illness, if it were a routine virus, then we advocate likely that you don't need testing. We are truly reserving the testing for those who are sickest so that we can prioritize the treatment of patients rather than the identification of patients early. And then the last thing I'd like to address is the issue of consumption of protective equipment while we are continuing to perform procedures. It's always a gentle and delicate balance to determine what procedures are truly necessary for a patient today versus what equipment may be available tomorrow. And we've fully understood that there have been guidance from Secretary Mandy Cohen from the Department of Health and Human Services about elective surgeries. We have actively been crafting updates on that or processes on that in our health system, and we'll provide an update on that later today or tomorrow for everybody. Happy to take questions later.
Good afternoon. I'm Fletcher Tove, Public Health Emergency Preparedness Director. Yesterday, we issued a supplemental declaration to our local state of emergency, and we received many questions about what businesses and venues are affected by that declaration. I will address that in a minute, but first I want to take a moment and attempt to provide some more clarity. And I'll step back and discuss the intent of that declaration and how it achieves our goal. So there's a lot of information that we don't have in regards to COVID-19. But we do know that it's more contagious and spreads faster than the flu. So we have a highly contagious virus with no vaccine and no treatment. That leads us to two possible scenarios. The first scenario is that we have a fast pandemic. The second is that we have a slow pandemic. In a fast pandemic, we have a big spike of people getting sick all at once, and they overwhelm our healthcare system. And we have to prioritize treatments, and many people may die. In a slow pandemic, we can reduce that spike so that we never overwhelm our healthcare systems and everyone can get the medical attention and support that they need. We don't have a lot of time to determine whether we have a fast or slow pandemic. We have a very small window, a window of criticality in which to act. And we believe that we are in that small window right now. If we want to avoid this being a fast pandemic and make it a slow pandemic, it takes all of us working together, and it takes all of us working together right now. We don't have a vaccine currently for COVID-19, so we have to socially engineer our behavior to act as a social vaccine. This is fundamentally done in two ways. One, not getting infected ourselves, and two, not infecting others. We accomplish this by washing our hands, cleaning high contact surfaces, keeping our distance, and avoiding close contact with others. Social distancing is a specific strategy proven by data to severely lessen the impact of high consequence pathogens by minimizing the opportunities for close contact encounters. That is the intent of the supplemental declaration issued yesterday, to mandate social distancing to act as a social vaccine. Now that we've spoken to the intent of the declaration, I'll attempt to clarify the message. First, yesterday's declaration limited all public gatherings to no more than 10 people across the county. We want to eliminate as many interactions as possible across the board where people are within 6 feet of another person for 10 minutes or more. This is considered close contact for exposure to COVID-19. We ask that the public use common sense and best judgment while adhering to the limit of 10 people or less, minimizing contact, and meeting social distancing requirements. Second, the declaration mandates closure of specified businesses and entertainment venues where close contact is routine. The declaration applies to gyms and fitness centers, to include martial arts studios, CrossFit gyms, and dance studios. It includes indoor pools and spas include massage parlors, medical spas, nail salons, beauty parlors, hairdressers, and barbershops of also the one-chair salons. We also include tattoo parlors, movie theaters, live performance venues, and arcades, including bowling alleys, indoor recreation centers, climbing gyms, trampoline parks, and escape rooms. This is not an exhaustive list. If your business or service delivery requires you to be within 6 feet of another person for a duration of 10 minutes or more, then it's likely that it falls within the local state of emergency supplemental declaration. This declaration does not include grocery stores, pharmacies, convenience stores, hardware stores, gas stations, farmers markets, and food distribution sites selling prepared food. These are locations where the public is not generally in close contact with other patrons. Essential health and safety services are also exempt from this declaration. To reiterate, this is an effort to be proactive and to safeguard public health. This next week is absolutely critical in Buncombe County's fight against the spread of COVID-19. These enhanced measures that we are implementing now are vital in reducing the impact the disease will have on our community in the long term. Buncombe County Public Health will reevaluate these measures on Friday, March 27th. The public in general, but also business owners who are not yet affected by these mandated closures, need to understand that during our reevaluation next week, that may lead to even more extensive closures, and they should prepare accordingly. Buncombe County Public Health is continually evaluating the latest data and guidance from experts around the globe to determine the actions that are best for Buncombe County. In closing, I'd like to take a moment to address an increase in predatory practices that bad actors are using to take advantage of public concern and fears regarding COVID-19. We know that malicious emails, phishing attempts, and ransomware attacks are up 40%. We know that bad actors are pretending to be charities, the World Health Organization, and the Center for Disease Control, and are asking for sensitive information such as social security numbers and credit card numbers. We know that they are specifically targeting healthcare facilities, healthcare workers, and government employees. So we ask that everyone be vigilant against these types of attacks, and they are occurring via email and via phone. We ask everyone to verify that any organization that reaches out is truly a charity and to safeguard your sensitive personal data. Thank you.
Okay. All right. So the first question is, the step down on testing was echoed by state health officials too, but it may be tough for the public to grasp. Can you reiterate why this shift is happening?
So I look at it as two main reasons for the changes in community testing or testing for COVID-19 overall. So the first main reason would be that we want to make sure that we are using our resources wisely and that we have them for the long haul, essentially. So when we do testing for COVID-19, we are using personal protective equipment, and we are exposing others, including healthcare personnel, to potential COVID-19. So we want to be sure to protect those resources because they will be very critical as we continue to see COVID-19 spread into our community, and we need those resources to take care of critically ill individuals. The second reason is that we know that most people who become ill with COVID-19 have mild illness. And so just as Dr. Hathaway said, if you think about if you have a mild cold, you don't necessarily go to the doctor, and that's something that a person can usually manage at home safely. And so we want to reframe this as if you have symptoms of fever and lower respiratory symptoms like a cough, stay home, manage your symptoms there, reach out to your healthcare provider if you're concerned that your symptoms are worsening. And of course, if you're critically ill, that would be a reason to call 911 and make sure that the dispatcher knows what your symptoms are and what you're concerned about.
I think you answered the question. Okay.
Do you have anything to add to that? Agree?
Yeah, that's perfect.
Is it likely that Buncombe County Health and Human Services drive-through testing will return next week?
I think it depends. I'm leaning toward probably not. But again, I think we're at the stage right now where we're evaluating how the testing went this week. We're evaluating our supply of resources and are actively trying to figure out the most appropriate response for our community.
Okay. Is there someone policing businesses for closures or penalties for businesses who may go against the emergency declaration and remain open?
Local law enforcement, to include Buncombe County Sheriff's Department and Asheville Police Department, as well as law enforcement from all the municipalities, are aware of our supplemental declaration. They're primarily responding by are complaint driven. If you would like to report something to them, we encourage you to use non-emergency lines. We don't want people tying up 911 for non-emergencies to report violations of this declaration. For the Buncombe County Sheriff Department, for non-emergency information, you can call 828-250-6670. And for the Asheville Police Department, you can call 828-252-1110. Thank you.
You probably stay up there. You mentioned further restrictions that will be considered next week. What might those look like?
So we have a think tank in our Emergency Operations Center considering all the possibilities we have to mitigate the spread of COVID-19. Possible options are even more extensive closures and mandatory closures for local businesses. And, our intent is to provide leadership and conceivable goals as we step up in mitigating efforts. If you look to California, we know that yesterday their governor limited all travel to essential life-saving travel only, and you essentially put 40 million people on shelter-at-home criteria. And we're looking at what we can take leading up to that before we get to that point. So there's a spectrum of options we're looking at as we address this threat.
Are there any updates on school closings?
The intent of Buncombe County and Asheville City Schools is to reevaluate at the 2-week point, which would be at the end of this upcoming week.
Okay. Got that one. Test results pending. What is the number of test results pending?
Right.
First question. It's a two-part question.
That's the first part? Okay. So in terms of test results, so I can break it down a little bit. So the tests that were conducted by our communicable disease staff here at Buncombe County, they've tested 13 individuals. 2 of those tests are still pending. Of course, all of the 370 specimens that were collected at our community testing sites are still pending. And then I would probably say that of the over 700 tests that have been collected out in the community, that number, over 700, is inclusive of those 370 specimens that were collected in our testing sites. But I would say that the majority of them are still pending. And I expect that many will start, again, returning early next week, probably on Monday. And in terms of how people will be notified of test results, so if the test was conducted by Buncombe County communicable disease staff or at our collection sites, we will reach out to those specific individuals with their test results. If your test was performed by your local healthcare provider or an urgent care, then those would be the facilities or providers who would be providing the test results. And I would again ask that people don't call us for test results. We'll be calling you, and know that we have many staff who are prepared, and we have a process in place by which people will get their results.
Okay. Fletch, this is a question for you. Again, you probably want to clarify further about the salons. We're still getting a lot of questions about one chair salons.
So again, the thought behind this is all about meeting that close contact criteria. So part of that declaration was limiting gatherings to 10 people. The other part was to eliminate close contact. And again, that's being within 6 feet of another person for 10 minutes or more. So I know we've got a lot of questions about people who have one-chair salons. And when you think about this, if you're getting your haircut at a barber shop or you're in a salon, your face is within 2 feet of another person's face for 15 to 30 minutes to an hour. That clearly meets our close contact criteria, and that's what we're trying to eliminate. So I understand some confusion because some of the guidance is saying public gatherings of 10 or less. Some of that is applicable because we're talking about close contact criteria, regardless of the number of people involved. And again, to clarify on spas, this declaration includes massage parlors, medical spas, nail salons, beauty parlors, hairdressers, one-chair salons, one-chair studios, and barbershops, among others. And again, if that's not exhaustive, if your service delivery involves being within 6 feet of another person for 10 minutes or more, you probably fall under this declaration, or if you don't, you need to severely understand the risk you're putting yourself and others at. Thank you.
Okay. Let's see. What else do we have here? This is for Dr. Hathaway. Are there plans to turn the old ER at Transylvania Regional Hospital into a COVID-19 testing facility with assistance from doctors and staff from local offices?
So as we prepared for the arrival of the illness to our community, we have had comprehensive planning for our facilities going on for the last 4 weeks at a minimum. We've looked at each of the facilities, the large tertiary coordinated care center, Mission Hospital, as our base where we care for our most critically ill patients. And then we've looked out both at hospitals within our system, and when I use the word system, I mean within Western North Carolina, and that includes Transylvania Hospital. and also hospitals outside of our system, meaning Pardee and Park Ridge and the hospitals west of us. We have a collaborative strategy, as always, to care for the sickest patients here in Asheville, where we have the highest intensity of resources and physicians to care for those patients. Without going into the specifics of each of the facilities' plans, I think it's safe to say that we've looked at all kinds of contingency efforts on how to manage these patients, from converting space in existing facilities to adding space that's been dormant, to moving patients from lower intensity levels to higher levels, from Transylvania to Mission, or if we needed space at Mission for the more critically ill patients, we've even talked about resourcing patients elsewhere. The point I want to make is that we don't know what we're going to be faced with, but we're preparing for all contingencies and collaborating not only with hospitals in our system, but hospitals across the entire 18-county region.
Is it possible to get the coronavirus more than once? What should be taken over the counter at home if you think you have it? How long does it take before symptoms show when coming into contact with COVID-19?
Make sure I hit all this.
Okay, yep,
All right, so again, we're learning about COVID-19 through this experience, but what the data appears to show is that you do develop immunity to the illness once you have it. The symptoms begin to show, the range is from 2 to 14 days after exposure to somebody with COVID-19, with most people maybe around 5 days later developing symptoms. And then what was the other question? What type? So it's symptom-based. So if you have a fever, then a fever-reducing medication like acetaminophen or ibuprofen. And then if you have a cough, I mean, there's limited evidence of cough medicines being effective, but I would probably focus on the fever-reducing medication. And what would you like to say, Dr. Hath?
Yeah, well, let me just, because it came up twice yesterday and I hadn't heard about it, there seems to be a lot on the internet about elderberry and ibuprofen, I believe. I just want to put it out there that there is no scientific evidence that ibuprofen at this point in time is harmful when you take this, as Dr. Mullendorf pointed out, or when you get this illness. As Dr. Mullendorf pointed out, that is one of the best inflammation, fever-reducing, and pain-reducing medications that we have. So, and we don't have any evidence that it's harmful. And frankly, I'm not sure where the elderberry comes from, but I have not seen any evidence that that's harmful for people either. So just to dispel those rumors, no scientific evidence of that right now.
Does the county's declaration closing certain businesses include auto dealerships?
So, auto dealerships, we were talking about that close contact criteria. They fall under the retail category. So if they're maintaining that social distancing, not having 6 feet for extended periods of time, they do not fall under the supplemental declaration.
Okay. This is the last question. So in the future, critically ill coronavirus patients from surrounding counties in western North Carolina will be transported to Asheville for treatment?
We look at the transport of patients to Mission Hospital on a case-by-case basis. We have a large transfer center that handles between 500 and 1,000 transfers monthly from regional hospitals into our facilities, maybe even more than that. We have a very good relationship collaborating and cooperating with the excellent physicians of our sister hospitals, of our hospitals in the region that aren't part of our facility. We have what we refer to as a spoke and hub model of care here. We are the hub, we are the tertiary and quaternary care delivery center in western North Carolina, we being Mission Hospital itself. and the other hospitals in the system that serve on the ends of the spoke often and frequently send their patients to us for care that they simply don't have the capacity to deliver there. We take care of patients who exceed the capacity of the regional hospitals routinely, and if we get patients who suffer from COVID-19 who fall into that category, we'll welcome them with open arms. We also, as I had said earlier, and I think it's important to emphasize, not knowing what is coming to us, have collaborative and cooperative strategies to redistribute patients if we need to do that. Hope we don't have to do that, but I say that to reassure the community that we're working in partnership with all of our neighbor hospitals to take care of the community.
Okay, so thank you to everybody here today. Over the weekend, we are not going to be doing camera updates. We will continue to send out a brief update over the weekend daily to media partners to notify you of anything significant, or just give you a status update just for your peace of mind. We anticipate resuming these updates on Monday. And as usual, and as everybody continues to emphasize, we encourage people to go to the CDC for the most accurate information on COVID-19. We also encourage folks to visit the state, North Carolina's Department of Health and Human Services website for North Carolina COVID-19 response information. And buncombecounty.org is the source for local COVID-19 information. And I think that's it. Thank you.